Hello, I'm Dr. Sangeeta. I'm a pediatrician and have been working with thalassemia and other hemoglobinopathies since 2002 in Varanasi. We have a non-government organization called Varanasi Region Thalassemia Welfare Society. Every year, more than 10,000 thalassemia major children are added. And in India, we have more than 50 million Indians who are thalassemia carriers. Great strides in control of thalassemia major in many countries had been made previously by making it mandatory to test for thalassemia before marriage or before the birth of a child. But World Health Organization advocates that this should be done through awareness and it should not be made mandatory. In an effort in this direction, seeing every year new thalassemia major children being born, I'm creating these slides to make it easy to explain to parents or would-be parents what is thalassemia. Now, thalassemia is an autosomal recessive inheritance. That means that if both parents are carriers, there is a 50% chance of passing the gene to the child who would be like them, who would be carriers. There's a 25% chance of having an affected child. An affected child gets one gene from the mother, one gene from the father. Now this child by 3 months of age starts showing all the signs of anemia. He has fatigue, he's crying, there's pallor, there may be fever. On investigation, it turns out that the child is thalassemia major. Now this child needs regular blood transfusions lifelong to maintain his hemoglobin because his bone marrow isn't able to cope with it. It needs a lot of investigations and there are risk of complications. This thing, a lifelong hospital visits, investigations, blood transfusions can be avoided if beforehand parents know they are carriers and can go for a chorionic villus sampling to know if they have an affected child. So the best strategy is prevention. Know your thalassemia status before planning a child. A simple test that may be advised by a doctor is complete blood counts, a general blood picture, hemoglobin electrophoresis, and serum ferritin. To illustrate my point, I would show you the blood picture of a mother, the blood report of a carrier parent. We find that the hemoglobin may be low but not very low. If we look at the mean corpuscular volume, the volume of each red blood cell, we find that it's below 80 femtoliters, when the normal being between 80 and 100 femtoliters. So this parent has 58 femtoliters. Then the mean hemoglobin concentration is also low. We find that the red blood cell count total is usually 5 million, and here it's not so affected. But this becomes an indicator that the parent has small cells, microcytosis, and she has hypochromia. There is less hemoglobin in each cell. For such a parent, then we go for serum ferritin because in India, the most common cause of having a microcytosis and hypochromia is iron deficiency. Once we have excluded that, then we can go for HB electrophoresis. This gives us, it's a graph in which the hemoglobin moves against a weak current and we can see which part of the hemoglobin comes out maximum. Now the adult hemoglobin is made of 2 alpha chains and 2 beta chains, whereas the fetal hemoglobin is made of 2 alpha chains and 2 gamma chains. Adult hemoglobin, around 2 to 3% normally, is made of adult hemoglobin 2, which is alpha 2 and delta 2. So in absence of beta chains not being made in enough quantity, the hemoglobin HbA2 rises. the free alpha chains combined with as many delta chains possible, and this is used as an indicator to know whether you're a carrier or not. Further genetic studies, mutation can be done to find out exactly what mutation the parent is having. Thalassemia carrier has varying degrees of reduced beta globin chain production. Also, if this carrier matches with another person who has a different hemoglobinopathy like sickle cell, hemoglobin C, hemoglobin E, then the child born having both the genes of this beta thalassemia and a new hemoglobinopathy may be a major or may behave like an intermediate patient who requires transfusions occasionally. But there is a chance of having a thalassemia major with other hemoglobinopathies also. So it is a good strategy to know your hemoglobinopathy status before thinking of having a child. Thalassemia carrier